they say a pregnancy is high risk, is not a death sentence. Your pregnancy is high risk. It means that either the mother or the baby have the tendency of coming down with one complication or the other, either during the pregnancy or after the pregnancy. So they have to take a closer look. Now, what do we look at and say that this woman's pregnancy is high risk? Number one, we look at the maternal features of the woman. We look at her health. We say, okay, this woman is hypertensive. She has the tendency of maybe coming down with preeclampsia. So we have to take a closer look at her, monitor her closely so that will not come up. A woman who is diabetic, we have to monitor her sugar. So make sure that it's okay during and after the pregnancy. Then we look at the size of the woman. Is this woman obese? Has the tendency of coming down maybe with hypertension. For someone who is underweight, the person has the tendency of giving birth to a low weight baby, which is so we have to do what? Monitor her and take a closer look at her. What do we look at again? We look at the woman's age. Somebody that is under 17 that is getting pregnant is an high risk pregnant woman, because she has the tendency of not delivering the baby on her own. You will see some of them sometimes in the hospital, 13 years old, 14 years old. Even there was one, a 12 years old who got pregnant. It's a high risk pregnancy because anything can happen at that point in that pregnancy. Then someone who is a woman who has been looking for a child, or somebody maybe that is her first pregnancy or that, because at that point the quality of the egg might begin to reduce, and some style of the woman. A smoker, an alcoholic, a drug addict, we classify them as high risk pregnant woman. Why? Because those things have the tendency of affecting the baby if not well taken care of. Related complications. Maybe the woman has had miscarriages before. She had preterm labor before, or this woman has been having deaths upon deaths, still births. We have to take a closer look at this woman. This weight is low. We have to do what? We have to take a closer look at her. That's why I always say, no way you will submit your body as a pregnant woman. Don't submit your body everywhere. This pregnancy is not taken care of, the woman can die, she can lose her baby, and she can lose her life.